Cancer is a continuously growing global health problem that poses major challenges, most especially in developing countries. Find out how this international distributor of innovative health products came up with a series of solutions to help increase a patient's chance to survive the odds. In 2020, the Philippines hit a record of 354,398 prevalent cancer cases within a 5-year period. But because of poor access to health care, especially for people living below the poverty line, the advances and breakthroughs in cancer remain unattainable to many.
Cancer refers to a group of diseases that's characterized actually by cell growth, abnormal cell growth and proliferation, inflammation, as well as angiogenesis or formation of new blood vessels. It always starts with mutation in the genome or the genetic makeup of a person inside the cell. Before PPARs, most of my patients, they were unable to finish the chemotherapy regimens because of the side effects and because of discomfort during the process of chemotherapy.
Maria's son Dominic was diagnosed with stage 4 rhabdomyosarcoma when he was only 4 years old. While coping with the recovery of her other sick child, Maria found it hard to accept Dominic's condition.
It was actually very devastating kasi with Dominic, it was manifested mga 4 years old na siya eh. Unlike dun sa daughter ko na congenital talaga, baby pa lang. Yung mga bandang September, meron ng umuumbok-umbok dito sa leeg niya. Hindi ko talagang iniisip na cancer kaagad siya until nag-nosebleed siya.
Dominic was prescribed chemotherapy, but his family insisted to rush to an integrative doctor to seek for alternative cure.
Medyo hesitant ako kasi as a mother, I know the side effects ng chemotherapy kasi. So what I did is that I rushed towards the integrative doctor of my daughter, who happened to be PPAR partner doctor of Simply Nature.
One of the hardest decisions to make for people living with cancer is choosing the kind of treatment that would work best. To help patients and their families deal with this growing health problem, one company commits to producing safe, credible, and natural health solutions by drawing on the latest bioscience technology to deliver a series of safe, efficient, and natural products. What is Simply Nature and what does it do?
Simply Nature is a company we created and founded about 10 years ago. Our mission is to find effective health solutions for people. So we provide natural products that work in combination with conventional therapy and medicine.
As an international company that provides natural solutions for cancer, metabolic syndrome, and degenerative diseases, the management upholds a health philosophy that centers on whole food nutrition as the frontier in health management.
When we talk about choosing treatment, especially in the area of cancer, patients are really afraid of chemotherapy because of its side effects, and they tend to then look towards natural products. But this is not a either conventional or natural choice. At Simply Nature, patients can have the best of both worlds. Our protocols work with conventional chemotherapy to minimize its side effects so that they can get the best treatment using both conventional and natural together.
Cancer is like a virus. It continuously evolves, it mutates. So it can develop defenses against our usual treatment modalities like chemotherapy.
Like I said, chemotherapy and radiation therapy have a lot of side effects. So more often than not, patients stop their treatment because of these side effects. It's very important to have the support.
With the supplements that we give the patients, there will be lesser side effects, so they will be able to finish their chemotherapy protocols more comfortably.
This company introduced PPARs, which is touted as one of the best natural ways of solving serious health problems.
PPARs stands for peroxisome proliferator activating receptors. It's basically a nuclear receptor found inside the cells. Now, when these receptors are activated, the benefit that you can get from that is, number one, cellular differentiation. Number two, it's to promote fatty acid metabolism. If you have better insulin function, your blood sugar will naturally go down. And another one is to induce cancer cell death by modulating the immune system.
As a sole distributor of PPARs, the company promotes its use to many reputable health institutions worldwide and actively organizes corporate health conferences and public health talks in Asia.
Simply Nature PPARs is made out of a special strain of these types of microalgae. It is very effective by protecting the bone marrow. We maintain the integrity of the immune system of the patient, which is very important to prevent infections and to fight off the cancer itself. And also, Simply Nature PPARs is also very dense in nutrients so that the patient can recover faster because of better cellular healing.
Sabi ko parang na-lead kami to an extraordinary and I must say amazing journey. I'm very proud of him. At a young age, na 8 years old, he believed that it's his purpose to siguro encourage other people then. We would like to really pay it forward with the knowledge that there's really like Simply Nature that can help people with cancer very much.
When fighting cancer, living healthy is very important because it allows us to pursue what is important to us in life, and that's what it's all about. When we can help a patient move from being bedridden to getting up, to be lucid in thought so that they can have conversations with their loved ones, it gives the whole process of fighting cancer a whole new meaning. And that is what drives us at Simply Nature.
Talagang sobrang sakit. Sumusuka na ako. Tapos sa work ko rin, hindi ko na kaya talagang mag-isip. Dumating ako sa point na nawala na din daw ako ng malay. Then, nakilala ko si Sir Shyan. Meron silang ganung product. Effect sa akin ng supplement na to is malakas ako. Kahit nagkikimo ako, nagre-radiation ako. Hindi ko naranasan yung mga naranasan ng other patient na nagsusuka, nanghihina, walang ganang kumain. My name is Saida C. Gomez, 48 years old. I live in Quezon City. Currently work is a property manager. Diagnosed sa akin is breast cancer no year 2019. After 2.5 years, is recurrent na siya for stage 4. Affected na yung brain, then lungs and liver. Kumalat na siya. Yung symptoms na naramdaman ko is talagang sobrang sakit ng ulo ko. Gumising ako parang sumusuka na ako. Tapos yung umiiba-iba yung way ng walk ko. Talagang as in vomit dito, vomit dun. Tapos sa work ko rin, talagang hindi ko na kaya talagang mag-isip. Parang lagi akong masakit talaga ang ulo. Na dumating ako sa point na nawala na din daw ako ng malay. Sabi ng mga kasama ko doon. Inaakay na nila ako. Then, yung pinakamatindi is yung dito na sa bahay na talagang inaano ko nung husband ko na gumigising ako pero talagang ayaw kong gumising. Kaya dinala na niya ako ng ER. Tapos doon na sila nag-test. Nagising na nga lang ako, nasa room na. Parang minuto na nga lang, wala na ako. Kasi talagang yung namamagana, swollen na yung brain ko. Nang ma-diagnose ako ng 2019 na I have a tumor, bukol, hindi ako nagpa-chemo. Basta it's natural, concentrate ako sa natural. Then, after ng 3 months, is sabi nila, is kailangan ko na daw ipatanggal. So, hindi na siya babalik. So, pumunta ako ng hospital, natanggal naman siya. Then, still, natural pa rin na product na aking tinitake. Pero, bumalik siya. Stage 4 na. Kasi nga affected na yung brain ko, lungs, liver. Actually, may ano na siya, sign na para sa bone. Yun yung mga nakita sa CT scan ko. Then, nakilala ko si Sir Shyan na meron silang ganung product. PPARs na powder and tablets. Yun yung trinay ko habang nag-start na ako ng radiation ng 18. May nag-chemo na ako. Natapos ko yung radiation ko for 10 session. So, okay yung effect. Nakayanan ko siya. May, nag-start na rin ako ng chemo para dun sa lungs and liver ko. And yung abdominal, kasama na rin siya. Every 21 days, 3 days yung aking chemo. With the help talaga nung Simply Nature, hindi ko naranasan yung nakikita ko sa mga kasabayan kong nagkikimo na nagsusuka, sumasakit, giniginaw, may mga ganun, tapos parang hindi talaga sila makakain. Minsan nga, hindi nila natatapos yung treatment nila. Pero ako, natatapos ko siya, is 3 days pa, na ang recommended sa akin is dapat naka-admit ako ng 3 days. Since tight lang din ako sa budget, is nag-decide na lang ako mag-uwian. Kasi strong ako, kaya ko. The following month ulit, nakaya ko siya ng hanggang 5 cycle. Di ako nagsusuka, nagugas ng plato, may konti akong pinagkakabalhang tindahan. So, nagagawa ko. When I was diagnosed sa stage 4 cancer, I cried, of course. Hindi mo naman maiiwasan yun. Pero I never felt na hindi ko kakayanin. Parang kailangan ko lakasan ng loob ko para sa family ko, lalo na sa mga bata, sa mga anak ko, maliliit pa sila. Yung husband ko, naiyak siya, syempre. Pero nung makita niya akong lalaban ako, parang nadagdagan yung fighting spirit niya na talagang lalabanan natin to, mami, sabi niya ganyan. Narinig ko nga sinabi ng doktor na less than a year ako, pero hindi ako kinabahan. Tinitake ko is PPARS powder, 2 scoop, nilalagay ko siya sa ilalim ng dila para ako matulog. Then 15 tablets every morning, empty stomach. Then sa afternoon din, 15 din ulit. Bumibili rin ako ng cleansing para panglinis. During chemo, radiation, ginagamit ko siya. Effect sa akin ng product, ng supplement na to is malakas ako. Kahit nagki-chemo ako, nagre-radiation ako, hindi ako nanghihina. Kaya kong bumalik sa normal na kilos ko after ng chemotherapy ko. Happy ako sa mga result kasi after 3 months, pinag-CT scan na nga nila ako at saka MRI. Good yung development. Nabawasan lahat yung mga measurement. Siguro yun yung effect talaga ng supplement na tinitake ko. This month is naka-evaluation. PET scan na po ako. Happy ako dun sa result ng CT scan at saka MRI. Kasi nga, yung sa MRI ko, yung sa brain is from 1.09 naging 0.08 na lang siya, yung measurement niya. Then yung sa lungs ko, which is yung chest scan ko, is 9.05 naging 4.05 na lang. I will recommend Simply Nature to the other cancer patient kasi it's very effective for me. Kahit nag-treatment ka at tinitake mo yun, hindi ko naranasan yung mga naranasan ng other patient na nagsusuka, nanghihina, then walang ganang kumain. Hi, I'm Saida Gomez. I have stage 4 breast cancer, metastasis for the brain, lungs, liver, abdominal, and bone. Thanks to Simply Nature, I'm okay now. And I trust Simply Nature.
mga ka-Simply Nature! My name is Jenny Lay and you are watching another episode of Simply Nature webinar powered by SMG or Simply Healed Medical Group. I'm delighted to see so many of you here today. Do you know anyone taking maintenance medicines? I am sure everybody knows somebody who is. This is a free webinar, so feel free to tag them and share with us which maintenance drugs are you taking in the comment section below. As a pharmacist myself, I know the most common ones are amlodipine, losartan, metformin, allopurinol. So, sino sa inyo ang mga umiinom niyan? Taas kamay! Tonight's topic is very prevalent. It's about hypertension, gout, uric acid, liver disease, and chronic kidney disease. So, to enlighten us, as he's an international speaker on a wide range of topics from personal success to healthcare, who is also the founding director of Simply Nature International, our PPARS expert from Singapore. You all know him, no other than Mr. Shyan Lim.
Hi, Jen. Hi, everyone. So good to see you here tonight. Everybody, tonight's topic is going to cover a lot of ground, right? As Jen mentioned, it's hypertension, gout, uric acid, liver disease, and CKD. I think the liver disease and CKD are both very, very important because they affect the quality of your life. And they do kill you very slowly, but very painfully. So this is a good topic to talk about. If you have any questions, we have a Ask Me Anything segment at the end of the program. And before I hand the time over to Dr. Jansen live today, I just want to say that the patients and viewers like yourself are changing. 5 years ago, everybody was probably very content with taking metformin and just taking your maintenance drugs. But today, maybe after COVID, there are a lot of concerns about metabolic syndromes. Many of us want to ask if we can actually get off our maintenance drugs. So these are very good questions. And the good news is we have all the solutions for you tonight. So Jen, I'll hand the time back to you as you introduce Dr. Jansen for our audience.
Thank you, Sir Shan. Now it's time to hear from another expert with a special case presentation. Dr. Jansen Kalalan graduated from St. Luke's Medical Center, College of Medicine in 2016. Then in 2019, he was conferred as a diplomate of not only Philippine College, but also the International Board of Lifestyle Medicine. He is also the president of SMG, or Simply Healed Medical Group, and a consultant at Alta Integrative Medicine and Wellness Complex at Perpetual Health Medical Center, Las Piñas. Take it away, Doc Jansen.
Hi, Jen. Hi, Jen. Hello, everyone. Good evening. So tonight we're going to talk about one patient of mine. I'll share you his story. So before we start, let me just share my screen so you get to see the gist of his story. Now, my patient was suffering from gout and the hypertension. Actually, mainly hypertension. And this is his profile. Okay, so this patient of mine is a 35-year-old male, rather young at that. Okay, who came in for cancer prevention. That was his main reason why he sought a consult. Okay, now, back May 2023, he came to me. Another complaint is, of course, history of hypertension. He had some instances when his blood pressure was 160 over 100 and up, which is really high. And by the way, 160 over 100 is considered as grade 2 hypertension. Okay? 140 over 90 is grade 1 hypertension. So the level of hypertension that he has is actually bad. Okay? And later on, this has actually very significant influence on his risk of cancer. So later on, I'll show you how much. Okay? Also, he has I'm suspecting that he has gouty arthritis. Why? Because he always complains of pain on his left big toe, right ankle, and right wrist whenever he eats beef. For gouty arthritis, one telltale sign that you have one is that you always feel joint pains whenever you eat something. May it be beef, may it be other foods, as long as there's a food trigger that then later on, after eating the food, you experience joint pains, then most of the time, uh, or more often than not, no, then most probably you will have gouty arthritis. Now, gouty arthritis, what tests do we use to diagnose gouty arthritis? We try to look at serum uric acid. However, that is not diagnostic. That is not a confirmatory test. No, the confirmatory test is we aspirate the joint fluid. If we see some uric acid crystals in the joint fluid, then you have gouty arthritis. Okay. Another problem that he has is that he is obese and also complains of hemorrhoids. Now, with this picture, with this kind of history, what does this tell me? Number one, his diet is bad. Okay. Just with the gouty arthritis in and of itself, foods that increases your likelihood of acquiring gout would be meat, especially red meat. Another one would be innards, or in Tagalog, lamang loob. So innards would include your liver, your kidneys, lungs. They eat that as well. Colon, they eat those as well. Okay. If you love those foods, if you love eating those foods, then your likelihood of acquiring gouty arthritis is very, very high. What else? Sweets. Sweetened beverages, pastries, etc. Sweets can also, or sugar per se, no, can also increase your uric acid levels. And because of this, the patient, no wonder, would become obese. Okay? Because how do you become obese? If you are sedentary and if you eat foods that are very high in calorie density. Specifically, if you eat very fatty foods. Okay? And lastly would be hemorrhoids. So if you're someone who has hemorrhoids, most likely you are constipated. If you're constipated, you don't move your bowel as frequent. If you don't move your bowel as frequent, then the amount of fiber in your meals would probably be very low. And if with a low fiber diet, that causes a lot of problems. Okay, one of them will be high cholesterol levels, elevated blood sugar levels. So those are just some. Okay. Now let's take a look at the medications that he is taking presently. So upon interview, he was taking telmisartan. Telmisartan is a medication for blood pressure. The same thing with and this is Angiomax. Okay. Colchicine is it's an herbal medication. It's a medication that was derived from herbs that is used mainly to manage acute attacks for gout. Okay, naproxen is an anti-inflammatory medication. It's a pain reliever. Okay, so with this, you will see that the patient have had this illness for quite some time now, since this was the prescription of his previous doctor. Unfortunately, he stopped taking his anti-hypertensive medication 1 month prior to seeing me. Okay, so these are his supplements, the supplements that he's taking, like vitamin C, apple cider, and CoQ10. Okay, in terms of family history, the reason why he really, or it made him consult that made him consulted me, no, is because of this family history of cancer. That's why he's really very interested in what his risk of developing cancer is. So because of his mother died from pancreatic cancer, and one of his relatives died from breast cancer. Okay, so now let's take a look at his lifestyle. So the patient is self-employed, and the 24-hour recall of what he ate is this one. So for lunch, he ate white rice, mongo. Mongo is a bean. He ate fried pork and fruit juice. So what did I tell you a while ago? For patients with gout, what are the triggers? Okay, so for dinner, fruit juice again, white rice, and baby back ribs. Okay, so no wonder the patient has gout. Okay, because again, what are the foods that increases your likelihood of developing gout? Number one would be meat products. Number two, sugar, high sugar foods. That includes your sweetened beverages like fruit juices. That also includes your refined grains. Okay, because refined grains have very low fiber content, almost negligible actually. Okay, what else? Bongo. Bongo can be one trigger, especially if your uric acid is already very high. Okay, eating more legumes can trigger gout. Okay, so this is what he ate. Okay, and this is his physical activity level. No? He told me that he is sedentary. For sleep, he sleeps well. He has good quality sleep. Okay. For his stress, it's around 6 or 7, which is acceptable. And he has no vices. For his vital signs, his blood pressure was 60 out of 100, 60 over 100 rather. So again, this is grade 2 hypertension, and this is really very high. And also, his BMI is 34, which is in the obese category. Now, my diagnosis at this point in time is I am thinking of gouty arthritis. Okay. Also, he has hypertension and he is obese. To be specific, um, yeah, obese class 1 to be specific. So, what would be my approach for this patient? So, number one would be to reverse the risk factors that can lead to cancer because this patient is very young. So, with age alone, the risks are in his favor. Okay, just with age alone. However, the problem there is he has these illnesses, he has these metabolic illnesses that can contribute to an increase in his risk of cancer. So, number 2 advice would be to tell him to eat a whole food plant-based diet because a whole food plant-based diet is the only diet that has been proven to have reversed diabetes, heart disease, and early stage prostate cancer. Okay, so it's the healthiest diet that you can eat for metabolic illnesses. And the more plant-based you become, the more effective it will be. Okay? Of course, we have to begin him or start him on some degree of exercise. So first, I told him to start doing some light cycling. Why light cycling? It's because I do not want to put pressure on his knees because he is obese. I do not want to put a lot of pressure on his knees because if we put a lot of pressure on his knees, this can result into osteoarthritis later on in his life. Okay, so I advise him to start doing some light cycling. Stationary bike cycling would be enough. At least 30 minutes every day. Okay, just to get things going. Also, I wanted to know his latest the latest status of his body. So I also requested for a complete blood count, the urine status, the blood chemistry status, etc. Just to see or just to have an inkling on how healthy or how bad his situation is. Okay, and of course, we have to monitor the blood pressure because at this point in time, although he told me that he has previous medications already, he has had a previous blood pressure reading of 160 over 100 already. I'm still skeptical. Okay, I wanted to have a more accurate a data that is latest. So I told him to monitor his blood pressure twice a day for 1 week, so that I also know what time of the day his blood pressure spikes up. Okay, now let's discuss obesity. So for obesity, this is does obesity have an impact on his cancer risk? No, so this study is the study that tells us that yes, there is an impact of being obese to your risk of getting cancer. So for each 5 kilogram per meter square of increase in BMI, this is associated with a moderate increase of overall risk of getting cancer. So the question is, what is 5 kilogram per meter square? And what is moderate? How moderate is moderate? Okay. So this next table shows us the BMI on the x-axis. So just for everybody's, to make this simple, no, the number that is important here is 25. Okay, a BMI of 25. Because a BMI of 25, that is already overweight according to the WHO. So overweight is a BMI between 25 and 29.9. Once you step on 30, you are considered as obese already. Okay? And on the y-axis, you can see there the relative risk of getting cancer. So, as you can see here in this graph, the higher your BMI, okay, the higher your risk of cancer will be. And this increases exponentially. The patient's BMI is where? It is at 34. So, the risk of the just by having an elevated BMI, a BMI in the overweight category, the patient's risk of acquiring cancer is at least 10%, nearing 20%. Okay, 20% increased risk. Okay, now this is just weight. Next, let's talk about his blood pressure. Now, upon follow-up on June 2023, this is just after a month, he complained of knee pain upon waking up. And upon waking up, he got his blood pressure reading, which came out as 160 over 100. This is the reason why he followed up actually. So I asked him, okay, did you did the blood pressure monitoring? Yes. This was his blood pressure monitoring for the past for the first 5 days of June. And as you can see here, it's at least 160 over 100 every reading, morning and evening. Okay, so this patient needs medication already. Okay, now next, ECG. Would there be something in his heart? Would there be a problem in his heart that leads to the hypertension? There's none actually. This is a normal ECG reading. Let's take a look at his blood chemistry report. This is his blood chemistry, and as you can see here, the one that is elevated is his is his fasting blood sugar, which is at 100. That is pre-diabetes. Okay, so pre-diabetes is borderline diabetes, but actually that's just technicalities, no? If you are pre-diabetic, you already have the disease. You are diabetic. Okay, you have impaired you have insulin resistance already. And what is considered as pre-diabetic is 100 to 125. Once you step on 126, that's diabetes. Okay, so this patient is pre-diabetic at this level. His cholesterol is surprisingly at 160. Okay, but I'm suspecting because the reason why is because this patient is quite young. Triglycerides is also wonderful. Okay, however, his uric acid is at 8, which is really quite high. Okay, next, let's take a look at his complete blood count. Now, for the complete blood count, what do I want to see here? I want to see his white blood cell count and his platelet count. For the white blood cell count, it is at 5.71, which is normal. Usually for these kinds of patients, their low-grade inflammation, there would be low-grade inflammation inside their body. And with low-grade inflammation, we tend to see an increase in white blood cell count. Okay? Since the patient is quite young, we don't see this just yet. Okay? For the platelet count, we do not want this to be elevated because a high platelet count would add on to the viscosity of the blood. So his platelet count is 361, which is acceptable. Okay. For the urinalysis, you can see here a protein of +1. Okay, this is a sign that there might be some problems in his kidney already, beginning problems. Okay, and this is something that he needs to reverse urgently, because if this is left untreated, then this can damage his kidneys and progress to kidney failure later on. Okay, for CKD, the number one cause of it happening, no, is hypertension followed by diabetes. And if you think about it, the patient is hypertensive and he is pre-diabetic already. So his body's environment, the inside environment of his body is actually very much very much incubates CKD, okay, or chronic kidney disease. So this has to be addressed. Okay. Also, another reason, it might be because of his dehydration, because he fasted for at least 10 hours. So this might be because this might be the reason why he has protein in his urine. Okay. So that's another consideration. However, again, the patient is hypertensive and pre-diabetic, so we have to address those two risk factors. Okay. So next would be I wanted to know whether or not the patient's inflammatory markers would be elevated, and fortunately, it's not. It's at 1.46, so inflammation is controllable. However, even if this is controllable, this we only know from this result is that the inflammation inside his body is not that high yet. However, there is inflammation inside his body. Okay. He also requested for fecal occult blood test. This test is mainly used to screen for colorectal cancer. It mainly tests for blood inside the stool. However, even if this is positive, it doesn't necessarily mean that you have colorectal cancer. It just prompts you to go for a consult and to go for further workup. Most likely a colonoscopy to check really whether or not you have colorectal cancer. Um, yeah, to check whether or not you have colorectal cancer. Okay, if this is negative, it also doesn't mean that you don't have colorectal cancer. Okay, mind you, however, if this is positive, then chances are it should prompt a further workup. Okay, for the whole abdomen ultrasound, what is significant here is his fatty liver. Okay, which is expected with his lifestyle, because why, he is sedentary and he eats a very high fat diet. Although his triglycerides is still normal. Okay. So at this point, what would be my assessment for the patient? That would be hypertension, grade 2. He is pre-diabetic, he has high uric acid levels, and he has fatty liver disease. So what would be my approach for this patient right now? It would be number one, to control the blood pressure, control the uric acid, and try to reverse the fatty liver disease. How? These are the medications that I prescribed him with. Okay. So that would be anti-hypertensive medication for the uric acid, vitamin B complex medication, and PPARs. What is the benefit of PPARs? What would PPARs do for him? At this point, it's to lower the inflammation. So PPARs would help his hypertension. Also, PPARs acts on the fatty acid metabolism, so that would help his fatty liver disease and being pre-diabetic or the insulin resistance. Now, of course, even if he is on medication, I don't expect this to normalize immediately. So I ask him to still monitor his blood pressure twice a day. Okay? And then repeat the test after 1 month. So this is the test, this is the repeat. Actually, it was just a few weeks, no, 2 weeks later, then he got another test. He repeated the test. So for this, his fasting blood sugar actually increased from 100 to 107. It's not that significant of an increase. However, definitely we don't see some improvement. His uric acid levels also increased, although it's not that significant, from 8.2 increase to 8.35. Same thing with fasting blood sugar. The increase is not that significant. However, definitely we don't see some improvement. Okay, even on medication. Okay, even on PPAR. So, what are the possible reasons why we did not see an improvement? Number one, the lab result was done too early. The lab test was done too early. Number two, the lifestyle change was not intensive enough. It means that his adherence to the lifestyle change that we discussed, he was not able to implement just yet. Okay? There's just one thing that is very consoling, is that the protein in his urine disappeared. So that is one thing that is very much in his favor. Okay. Now, next, let's discuss. Let's take a look at the patient's risk for developing cancer. Now that we have established that he is hypertensive and pre-diabetic as well. Okay. So in this study, they investigated the effect of being pre-hypertensive on the risk of cancer. Furthermore, They also looked into the effects of being undiagnosed with hypertension and the effects of having high blood sugar. Very much the same with our patient. Now, this table is very toxic looking, but please bear with me and listen carefully. Okay, this is the effect of blood pressure and blood sugar levels in the risk of cancer, and we will look at where the patient stands in terms of his risk of cancer. Take a look at this row. These are patients that are not hypertensive and not diabetic. They would be our reference. And we will compare the profile of these patients to our patient. Okay? So what the number 1.0 mean is here is that their risk of cancer is neutral because they are our reference point. Okay? Now, for any number greater than 1.0, such as this, it means that the risk of developing the specific cancer, in this example, lung cancer, will be elevated. Elevated by how much? By 32%. Okay, this is how we interpret this number. Now, on the other hand, for any number less than 1.0, such as this, it means that the risk of developing the specific cancer, in this example, lung cancer again, will be reduced. Reduced by how much? Reduced by 36%. Okay? This is how we interpret these numbers. Lastly, the numbers in bold font are the numbers in bold font are those which are statistically significant. It means that the conclusion that we are able to draw from these values are reliable and did not occur by chance. Those numbers that are not in bold font are not statistically significant, meaning they only occurred by chance. Okay? So next, let's take a look at the profile of the patient. So these this is the profile of the patient. So again, the patient is hypertensive. What his blood pressure is 160 over 110. Okay, so that is what considered as undiagnosed hypertension according to the researchers. On the other hand, his fasting blood sugar is at 107. This is pre-diabetes. So where does he stand? Okay, so take a look at the plus signs. 2 plus signs for his blood pressure and 1 plus sign for his sugar. Okay, so this is where the patient is. This is the risk profile of the patient where we can see that he has a 7% increased risk of developing cancer, which is quite significant. Now, which cancers would he be at risk of? At this point in time, definitely not cancer of the lung, prostate, colorectal, stomach, or liver. Might he have an elevated risk of other cancers aside from this? Yes. Which cancers? If we base it on this study, we do not know. However, what we can say is that he has a 7% increased risk of developing cancer, just basing it from him being hypertensive and pre-diabetic. So, this is the plan for the patient. Okay? Hence, this is the plan that I made for the patient, which is more importantly to adhere to a plant-based diet. Now, why is fish consumption here allowable? This is to have a compromise. Okay? So, that would be all. We can now go into the Ask Me Anything segment, and thank you for listening.
Thank you, Doc Jansen. Questions are very much welcome. Just type them down in the comment section below. Kahit Tagalog, okay lang po. Now, if you want to know your risk of metabolic disease and health recommendation for free, this is limited to the first 10 persons only, okay? So just chat us your age, height, and weight so we can calculate your BMI or body mass index for free. Okay, so chat now, guys. But first, I would like a shout out to our avid viewers, Miss Lily Lu from Malaysia, Helen, Edna Alarcon, and Mamila Lazaro. Webinar is not complete without you. Okay, I can see a lot of questions coming up and shown privately. So let's start the AMA. For first question, Ma'am Yolanda Makapili. Go chemo, Dr. Jansen. Please answer po. What kind of cancer, ma'am?
Yes, correct.
Yes,
Yeah, yes,
so let's
Jen,
go to the second
you're
question
getting good.
now.
You're getting good, Jen. Yes, that's the first question that I would ask. First, what cancer? What stage? And would chemotherapy be even applicable? Are you contemplating surgery or not? Okay, because this will determine the number of cycles of chemotherapy that you will undergo. But just to give you a general idea, typically, cancer patients who undergo chemotherapy that would range around 6 cycles to 8 cycles. Some goes up until 12 cycles. If you are contemplating surgery, chemotherapy first, then surgery, then that would be at least 3 or 4 cycles. Then you undergo surgery. Okay, so that's the usual number of chemotherapy cycles that you have to undergo before you before anything else. Okay, so yeah.
Thank you, Doc. Let's jump to the second question from Andy Daplas. What to do for a laboratory result of high creatinine?
We have to determine why your creatinine is elevated in the first place, because there are a lot of things that can increase creatinine levels. Not just a problem with your kidney, it can be a problem of physical activity as well, because if you exercise too much, your creatinine will increase. So yeah, we have to find out the main reason. So I think it will be better to go for a consult so we can address this issue better.
And for those of you who wish to have a consult with Doc Jansen Kalalan, the link to schedule an appointment is in the description box or comment section below. Our pretty healthcare specialist Beth will reach out to you shortly. Let's go to the third question from Mr. Manuel Go. What is the difference between Fozal and Tamplas? I think the next webinar will be better for him. It's about prostate cancer.
Okay, first, these are brand names. No, let me take a look at the generic name so I can answer you better. Okay, for a while.
Okay, while Doc Jansen is checking that, let's jump to the next question. From Miss Melinda Navarro. Can you still reverse type 2 diabetes if you are taking 3 medications already?
Oh, I'll jump in and answer this one. The answer is an absolute yes. All right. Type 2 diabetes is onset diabetes, so it's developed. Okay, your family can have a history that makes you susceptible to developing type 2 diabetes. But unlike type 1 diabetes is genetic. And there is a genetic flaw. Your body is not able to produce some hormones, so that's why you develop diabetes. But for type 2 diabetes, yes, it can be reversed. If you're on 3 medications already, then it's probably quite serious. So for that, I would advise you to go and have a consult with Dr. Jansen, just so that he can take a look at your current medication and advise you how you will drop or lower the medication over time. So there it is, right? Are you happy? Because my answer is a straight positive. You will be able to reduce your maintenance drugs and reverse the diabetic condition. So the only thing is, since you're on 3 medicine, I think a good advice is not to just take PPAR tablets and drop it, but to actually have a program. That means a stepped way where perhaps after 10 days testing your looking at your blood sugar, Dr. Jansen will tell you that you can drop maybe 1/3 or a certain amount of your dosage of your medication. So what we want to do is actually monitor the way you can drop your medication. For the rest of the audience tonight, you can, if you're mild diabetic, you don't really need a consult. I know I was talking to Dr. Jansen because even Dr. Jansen would prefer to meet patients who are more serious. Because his time is also limited, although he's always happy to find a slot for you. So for those who very mild diabetes and blood cholesterol, just borderline, or just, you are diabetic but not serious, you can simply take Simply Nature PPAR tablets, all right? What's the dosage? Dosage is 10 micro tablets, which is really, really small. They're like Tic Tacs, okay? 3 times a day, okay? How fast will you see results? You will see results as fast as like 3 or 4 days. I'm not saying that your blood sugar level will be consistently normalized, but what you will feel is You probably feel more energetic, less sleepy. The symptoms of diabetes would seemingly improve, all right? Now, how long will it take your blood sugar to normalize? The usual amount of time is about a month, all right? Now, after a month, if you stop the Simply Nature Pipa tablet protocol, then what will happen is your blood sugar may start to rise again. Now, the reason is because it took time for you to develop diabetes. It will also take you time to actually reverse it, right? Drugs are different. The moment you stop taking the drug, your blood sugar goes up. But for what you're trying to do and what we're trying to do is help you reverse your diabetic condition. And that will take some time. So preparing your heart at least 3 months, but as fast as the first month, your blood sugar actually is normalized already. And you could probably be off some of your medication. For those of you who are mild diabetic or just normal diabetes, you could be off your medication, but it doesn't mean you can be off Simply Nature Pipa tablets. Continue for a period of at least 3 months, and that's where your condition will actually reverse. And the good news is also your blood cholesterol is going to improve as well. If you're on diabetic drugs, one of the side effects of diabetic drugs is high blood cholesterol. So it's very likely if you've been on medication for a long time, you might have blood cholesterol issues as well. So good news, same dosage, you don't take extras because you have diabetes and blood cholesterol. Same dosage, you're gonna get well. For those who are slightly serious, please make a consult with Dr. Jansen. He might actually even recommend you soft gel capsules for those who are on the real serious side. Now, if your foot is gangrene and you might have to face amputation, I just want to let you know, we have saved many foot in Philippines. Okay, so we have seen so many cases where the doctor says, in the next 3 to 5 days, it's very likely we gotta amputate the foot. We have saved so many of those conditions, right? For those, really go for a soft gel capsule. And if you're just taking Pipa tablets, you've got to take at least 10 micro tablets 4 times a day, because you're trying to save a gangrene foot. Okay, so definitely for those of you who are at risk of that, please immediately order the protocol and get on it, because you can save your foot. That means being able to walk properly for the rest of your life. Yeah, Doc, back to you. You can answer the previous question.
Yes, okay. Difference between Fozal and Tamplas. Okay, so the generic name of these medication is, for Fozal, that's alfuzosin. For Tamplas, that's tamsulosin. Now, these two medications are very similar in that they improve your urination. So the problem here is tamsulosin, the effect on your blood pressure is less. Okay, it doesn't influence your blood pressure that much. However, alfuzosin can influence your blood pressure. What can it do? It can lower your blood pressure. Okay, so if you are someone who has normal blood pressure levels and you have difficulty in urination, you have lower urinary tract symptoms already, then alfuzosin might be something that might not be a good choice. Instead, use tamsulosin instead. So because tamsulosin is selective in that it does not influence blood pressure that much.
Thank you, Doc. Now, for the next question, Ms. Ruth Mariano, is it safe taking allopurinol, amlodipine, atorvastatin for a long time?
My stand here is as long as you are not overdosing, as long as you are not using these medications for wrong reasons, then it is fine, because these medications can prevent complication from the diseases that they are addressing. So for the statins, you have to be on it if you are not on a plant-based diet and if your cholesterol is high, because if you have a high blood cholesterol, your risk of developing heart disease and stroke will be elevated. You need statins for that. Okay? Number 2, allopurinol is for uric acid. If your uric acid is persistently elevated, then you will develop gout. Okay? Allopurinol lowers uric acid. And what's the other one? No. The other one, atorvastatin, allopurinol.
Allopurinol, amlodipine, atorvastatin.
Amlodipine is an anti-hypertensive medication. You need that. If you don't take that, then your blood pressure will be elevated. If you have a high blood pressure, you risk destroying your kidneys, you risk heart attack, you risk stroke. Okay, so continue taking those medications, please. Okay, and if you want to lessen the number of medications that you are taking, then make sure that you have reversed the illness that you have. How do you know? You have to be guided by your doctor. Okay, only your doctor should tell you that, hey, it's okay to stop taking these medications already. And when your doctor tells you to stop your medication, then you follow. Okay, that's the only time that you follow. Okay, or else you risk complications happening later on, just like the patient that we've just talked about right now.
Doc, I just want to ask you a question because, I don't know whether you asked your professor at school, but I asked my pharmacology lecturer then. And yeah, Jen, you're a pharmacologist, right? I did ask because, when we study pharmacology, there are so many drugs that actually seem benign. They don't have like any serious side effects, right? They are considered really safe to take. I mean, you can literally swallow 100 aspirin, and if you're a normal person, you would actually, you actually be fine, right? So there are actually so many drugs that we are told that they are safe. However, drugs are not grapes or bananas. If you don't have a reason to eat it, don't eat it, right? So, Doc, I just wanted to share that, I think it's also important that patients understand these drugs are safe because your problem is bigger than any mild risk that the drug may have. Okay, but if you are perfectly healthy, no doctor will prescribe you even aspirin. So I think even when we say a drug is totally safe, please understand that no drug is totally harmless, right? So we have to have a reason why we want to take a particular medication, right? So we don't take it like a Tic Tac or a piece of chocolate or banana. It's not for nutrition. It's because there's something not right in your body, and the risk of the drug is really so small. And since you have a problem, it's very safe to take for a long time. However, today, I was just in my office. I just met a Philippine celebrity, and he's 43, but he looks like in his 30s, and he actually won like awards for like those marathons and parkour competitions. He's really, really fit. So I think there is a growing movement and understanding among people right now, especially people are aging, that they want to be at the peak of their health. You don't want to, you actually not just want to be sick, not to be healthy, but actually not, you actually don't want to be sick, and you actually want to be healthy. So for those patients, then I would really encourage you to aim to be so healthy that even the safe drugs you don't have to take. I think that's a good goal, and that's also the goal of lifestyle medicine. So for those of you who want that, you go and find a gym instructor if you have not disciplined enough to go to the gym. But when it comes to diet, how to achieve this, how to be healthy and eat right, I think a simple consult with Dr. Jansen will be great. That will give you a clear idea on how to do that, and you will be able to get off your maintenance drugs. All right, for those of you who are mild cases of cholesterol, diabetes, even though drugs like metformin are very, very safe to use, it's just good to be able to get off it, right? So aim to be that you don't need such drugs, that you can reverse your diabetic condition, you can reverse your CKD, you can reverse your liver diseases as long as they are not in the late stages, so that you can live a drug-free life. So I just want to add that.
Thank you, Sir Sean. Okay, next question from Miss Hannah. Is glucerna and cocoa powder okay for diabetic foot gangrene?
Okay. Lucerna and what's the other one? Cocoa powder?
Yes.
No.
Okay, here's the thing. If you are asking if it's good for gangrene, no, is it used to treat diabetic foot gangrene? No, it cannot be used as a treatment. No matter how much glucerna you drink or how much cocoa powder you drink, your gangrene, your diabetic foot will not go away. Okay?
Yes.
Now, if you're asking if it's good, yeah, you have diabetic foot gangrene, no, that means you're diabetic. If you're asking if these two foods would be good for diabetic patients, then it is. It is. Glucerna is mainly used or mainly prescribed for diabetics. Okay, it's a meal replacement food. Okay, so it's fine. It won't do any harm. However, the thing here is if you are not if you're drinking only glucerna, then there might be a chance to reverse your diabetes. Okay. However, if you're drinking glucerna and eating other foods, the question is, what are the other foods that you're eating? Because the other foods might be harming you. Okay, cocoa powder depends on how you make it, how you prepare it. Then yeah, then you turn that into chocolate. Do you turn that into a cocoa drink? What other foods do you use it together with? Okay, those will determine whether or not it would be good for you. But in general, cocoa powder and diabetes per se, um, cocoa powder is not harmful for diabetics. It is not. Okay, especially the one that was just freshly ground from the cocoa. Okay, not chocolate. Okay, not chocolate. Chocolate and cocoa powder are very different. Okay, so
And
there you have.
definitely not the 3-in-1 mixed cocoa powder, diba? Uh,
Right, right.
uh, again, to everyone, since we're on this question on metabolic syndromes, the big difference between the lifestyle adjustments that Dr. Jansen will give you and PPAP protocol is PPAP protocols like PPAP tablets and soft gel capsule is not like cocoa powder. It actually will work to remedy or reverse your diabetes. So it's not just good for diabetics, right? It actually works to reverse your diabetic condition. So that's a very big difference between, for example, taking ampalaya. So imagine you're diabetic. If you had to eat green vegetables that day, you eating ampalaya will be your best choice because that's good for blood sugar control. However, you wouldn't just want to eat ampalaya as a form of treatment, especially if your diabetes is serious. However, our PPAP tablets can actually be used to manage your blood sugar if you are diabetic. Okay, so that's a big difference there, everyone.
Thank you, Doc. Thank you, Sir Shan. Speaking of PPAR's protocol, the question of Miss Mila Lazaro, for the case of high cholesterol and high uric acid, what is the best PPAR's protocol?
What would you recommend, Doc? High uric acid and high blood sugar.
I would recommend tablets.
Yeah.
Just tablets would be enough. Yeah.
Yeah, me too. And the good news is that the dosage is the same as what we suggested just now. 10 micro tablets, at least twice a day, preferably 3 times a day. And you know what? Both the uric acid and the blood sugar will be worked on at the same time, okay? And then you don't have to take another drug. I mean, if this was, if you use conventional medicine to manage this, you'll be taking metformin for your diabetes and another drug for your uric acid, right? So no, you all in one. And if you likely have blood cholesterol, it may not be so serious. It might be on the high side. Even that will come down. So it really is the best. However, remember, if you are on diabetes and medication, don't just drop your medication. Let it come down step by step. That means test your blood sugar levels. If they're still normal, then you lower your dosage of the drugs that you're taking for at least a week. Make sure that the blood sugar is still normal, even though your metformin drug dosage is lower. Then you can lower it a little bit more, and step by step, after about a month, you can be off maintenance drugs if you're not a serious diabetic. Again, remember, if your diabetes is serious, please have a consult with Dr. Jansen just to check that your dosaging, how we bring down the dosage is safe, all right? Doc, what would you consider, what blood sugar level is serious?
126.
Okay.
If you are diabetic, it's serious already.
All right, so 126 and above, don't try to do it at home thing, all right? It will probably work, but what if, you know, you had some other conditions that you were not aware of and complications arise? So if you're 126 and above, just go for a consult with Dr. Jansen. You don't even have to take the bus or anything. You don't have to brave the traffic. You can do it right from your office at work during lunchtime if you want, or right after office. Just have a teleconsult with Dr. Jansen. It's going to be a simple short consult because this is something that Dr. Jansen does day in and out. I think even with his eyes closed, he can help you. But no, he will keep his eyes open, all right? Okay. Next
Okay. Another question about PPAR's protocol from a patient of Dr. Jansen, Miss Marlene Thomas De Leon. Doc Jansen, how come you prescribe PPAR's tablet and PPAR's soft gel when they have the same function? Is it true?
You want me to take this one, Doc?
Sure.
Okay, I'll take this one because I'm the product expert, all right? Doc is the expert in the treatment, all right? Okay, the function of the two products are similar, but different in usage, okay? Let me explain to everyone how... Oh, Doc, I had a very good conversation with another doctor and he gave a very easy to understand explanation for clients on how PPAR works, okay? So I'm going to tell you this illustration and go back to your question. Okay, number one, for a person to be healthy or to get well, there are two important pathways to think about, right? One is the metabolic pathway. So basically how your cells burn energy, how your body works, moves, okay? Literally on a cellular level, right? So that's the metabolic pathway. Now imagine a plant, right? If you want to treat a plant and you want to make a plant healthy, the metabolic pathway is the soil and the fertilizer that you put in the pot. So your plant has a lot of fertilizers and nutrients, right? Now, what happens if you put the plant, right, in the room with no light and you pull the curtains? Your plant is not going to be healthy even though there's a lot of fertilizer in there. There's another pathway which, to make it simple, we'll call it the signaling pathway, okay? So the sunlight is like the signaling pathway. The sunlight gives a signal for the plant to be able to use the nutrients in the soil and the fertilizer. So this is why some people, they take lots and lots of supplements, but they're not getting good results because the signaling pathway is not activated. The signals are not sent to utilize the metabolic pathways, the nutrients that are there, right? So very good, very simple analogy for you to understand, right? You could be eating the most expensive, or you're taking Enlin or all these supplements, and then how come things are not going well for you? It could be your signaling pathways are not working, all right? So that's why. Now, what's the difference between soft gel and tablets? The tablets is more like the metabolic pathway with a little bit of signaling, okay? The soft gel is almost like 75% signaling and a little bit of the, or more like equal, right? Signaling and the metabolic pathway. So that's why if your condition is serious, you will want to have the soft gel because your body is probably not even giving the signals anymore, okay? Now, why do you still put the soft gel together with the tablets? Because remember, the soft gel is more of the signaling, less of the metabolic pathways. So after you give the signal, you still need the nutrients, right? You have sunlight, but no soil and no fertilizer, your plant will still dry up, right? So you need both. So now you understand, if you are serious, again, we use a plant very simple. You put the plant, a fertilizer in the soil. Now, if your plant is really weak, what will you do? You give it good, strong sunlight. Not just the fertilizer, but you also put it good sunlight, right? But if it's not so serious, then you don't need to put it in a very lighted place. Even indoor, as long as there's enough fertilizer and you water, the plant will still be okay. So I hope this gives you a understanding without going to medical terms and being technical. So the soft gel capsule is really to activate. The tablets is to provide the fuel. Now, for those of you who are not seriously ill, just the mild signals in the tablets is sufficient to get everything started. But if you are more sick, you definitely need more of the triggering. Doc, is that okay?
Yes, that's wonderful. It's actually a very good analogy on how PPARs work.
Yeah, when I heard it from the other doctor, I was like, wow, I've got to share this. So it's even better than my car and car key and petrol thing. Yeah.
It's true.
Yeah, it's more correct medically speaking, right? Yeah. I hope that answers your questions. If you don't understand, just ask again. I'll elaborate if I need to. But if that helps you, then I hope it also helps everyone else.
Thank you, Sir Shan. Okay, next question coming from Miss Violi. Dating Ginoo. Good evening. I have a hypertension maintenance telmisartan plus amlodipine. And so far, so good. I have a normal BP, 110/80. And my blood chem results are normal level. Now, the question is, can I take my maintenance every other day na lang?
Depends. At this level of your blood pressure, no. It also depends on your lifestyle history. So I have to answer your question, you have to go for a consult because I will need to know, I will have to do a comprehensive interview about your lifestyle to know whether or not it's safe to take your medication every other day or at least half the dose or probably change to another medication, a cheaper one probably. So yeah, I have to know what your lifestyle is.
Thank you, Doc. Next question coming from Miss Peduca. I'm interested in treatment of arthritis. What's the most advanced treatment?
I don't think there's no such thing as most advanced treatment, okay? However, here's the thing, no, for arthritis, the mainstay would still be to address the root cause. Why do you have arthritis in the first place? Addressing that will definitely resolve the arthritis, the pain. Aside from that, say for example, you have osteoarthritis. Osteoarthritis is something that we get when we grow older. So it just happens, no, more often than not. Osteoarthritis can also happen because of high blood cholesterol level. So how do we treat that? You can undergo total knee replacement if it's that severe already. Another one, if you want to preserve your knee, is to undergo steroid injections inside your joint, no, your knee joint. Another treatment would be prolozone therapy. Prolozone is when you inject ozone gas inside your knee joint. It's also quite effective, and there are a lot of clinics around the world that does that. Here in the Philippines, we have a few clinics who does that. So it's basically ozone gas injecting ozone gas to your joint. Now, what does the ozone gas do? It causes a mild irritation to stimulate the healing process. Okay, and on top of that, since you are injecting ozone gas to assist the healing process, you would have to inject vitamins as well, so that the cells in your joint will heal properly. With the studies that I have read, prolozone therapy is really quite effective, and its effect is even longer than steroid injections. Yeah, and the side effects is not that significant. Usually, a few days, the fullness around your knees disappears, and the pain intensity lessens throughout the months. So, how often do you need prednisone injections? Once a month. I think once a month would be enough already, or at the most probably twice a month. Yeah, that would be done for the next 6 months.
Yeah, on this for arthritis again, one of the key causes is inflammation, right? So one thing that works very well, okay, just to give you an example, there is one of the doctors that work with us. This is her own family member. Her own family member has psoriatic arthritis, all right, psoriatic arthritis. So it's really very painful. It's so painful that her family member has to have an injection into the joints, all right, especially her knee joint with drugs. This is not what Dr. Jansen is talking about. It's not ozone therapy. With drugs every 3 to 6 months, just to relieve the loved one of pain. Okay, so that's how serious it is. Now she took, of course, she also has psoriasis all over her body as well. All right, so this is a psoriatic arthritis. So on soft gel capsule, if I'm not wrong, it's 2 soft gel capsules a day plus tablets. It took the sister about 6 months, but basically the good news is now I mentioned something. Okay, the family member, all right, the family member actually does not go for the injections anymore. Okay, so that's really wonderful. So if you are not able to avail the physical treatment that Dr. Jansen is saying, okay, I would definitely recommend you go for soft gel capsule. Okay, 1 soft gel capsule a day, and then micro tablets, 10 tablets twice a day. Okay, it's gonna, anyway, remember, it's gonna bring down your blood sugar, it's gonna improve your blood cholesterol, it's gonna really bring down your inflammation throughout your body. So things like gout is our topic today, right? Gout would actually be improved, and actually it will get well. All right, so all these things will happen at the same time. So if you are saying most advanced, as Dr. Jansen say, what is advanced? Because the most effective treatment could be the older ones and not the new things that come around. That's why he's saying not advanced. I guess to answer your question, the most powerful, if money is not an issue, all right, then take 2, 3 soft gel capsules a day, and you should really see good results. All right. And then of course it will take some time, but you should see good results. Now, if you do actually go on a protocol like 2 or 3 soft gel capsules a day, and after, for example, 2 weeks, you don't see any significant improvement, that's when you want to go to a consult with Dr. Jansen so that you can check, hey doc, I'm taking this, it should be helping me now. How come, what's wrong, right? So again, it could be another factor in your life that's fighting against the treatment. So you see improvement, but not the full improvement that you want. So that's when you really need a consult to tweak what else is wrong in your life, lifestyle, or it might be something else that you're taking.
That's true. Thank you, Sir Shyan. Okay, next question from Chris Pondok. Hi po, what is the effect of intermittent fasting to SGPT, SGOT, and BUA? Because I have elevated results of those tests. Thanks.
It depends on what you eat when you're undergoing intermittent fasting. So the schedule of your eating will not affect these parameters as much if what you're eating is still not healthy. Okay. So if you are eating up mainly the diet that is recommended for these, a plant-based diet, then even undergoing intermittent fasting will just hasten the reversal, the healing process. However, if you are not eating the right kind of food, even if you undergo intermittent fasting, it will not have that big of an impact. Okay, I hope this clarifies. Okay, because intermittent fasting is just prolonging the amount of time or the period of time that you are not eating. It's just scheduling the food intake. Okay.
Thank you, Doc. I actually have a question from my client. Can we take PPARs during intermittent fasting?
Oh,
yes. Of course.
And then for anyone who's actually doing fasting, or you can't eat food, for example, you are a speaker like Dr. Jansen and me for a conference and we don't have time for lunch. we can actually pop in like 20 micro tablets and that will keep us energetic. All right. It's like a meal replacement. All right. Yeah.
Thank you. Okay, next question from Haya Dalid. Okay lang po ba pagsabayin allopurinol and febuxostat?
No, because those two medications do the same thing. It's to lower your uric acid. You don't drink medications that does the exact same thing. Okay, that will cause adverse reactions. Okay, so don't take those two together.
Yes, that's true. Okay, next question from Ruth Mariano. Is taking glutathione capsule is safe to those who has high cholesterol, high uric acid, and also hypertension with fatty liver? Thank you so much.
Yes, it's okay. It won't do any harm, but the question is, will it have any benefit? I doubt. Especially oral glutathione. The glutathione that I prefer is IV. Why? Because glutathione is a protein that can be digested by your enzymes, by your intestine. If it's digested, that would be broken down into individual amino acids. The glutathione that you drank or you ate will not be the same when it gets absorbed into your bloodstream.
Yun. Thank you, Doc. Next question. For Melinda Navarro. Oh, she missed this webinar. Doc, is there any significance on why a patient with acid reflux can drop sodium and potassium as well as hemoglobin after vomiting several times? What could be the reason behind these complications?
Very good question. Why? Because your stomach produces potassium, your stomach produces sodium. Okay? And usually, together with the production of gastric acid, is potassium. Okay, the stomach produces potassium together with the gastric acid. So when you vomit, your stomach will draw more potassium from your blood to produce more stomach acid. Okay, that's why you experience a decrease in potassium when you vomit repeatedly. For hemoglobin, the only reason why I see a drop in hemoglobin because of vomiting is that you are vomiting blood. Okay? And yeah, that's the question, right? Yeah, okay, so that's the answer. Okay.
Okay, thank you, Doc. Next question from Cora Sario. Good eve po. Wait, let me translate this to English. My knees hurt and I'm hirap maglakad pag matagal nakatayo, halos di maigalaw kanan na bente. Parang naglalak sa joint, sa tuhod. I was prescribed Celecoxib for pain. What else can we do, Doc?
First, I will have to know why the patient is experiencing such, no? So first is metabolic issues. Number two, have this patient had any previous history of trauma on the knees, accidents perhaps? Another one would be, is this person overweight or obese? And yeah, basically those are the things that I would have to find out to help this patient better. So I think it will be better for her to consult. But right now, the medication for the pain is correct. It's celecoxib. But however, you cannot take celecoxib for a very long period of time because celecoxib, if you are taking this for long periods of time, one complication of this medication is that your blood will clot easier.
Okay, thank you, Doc. Next question from Jairus Gabriel. What medications can you recommend for high SGPT 500 and high SGOT 300? Thank you.
Better go for a consult. I would have to find out first why your SGPT and SGOT is very high. So for everybody's information, no, SGPT and SGOT are liver enzymes. Liver enzymes usually increase if there's liver damage or if you are taking medication. Okay, so at this kind of level of SGPT and SGOT, I would presume that the liver has some significant damage already. And we have to find out what kind of damage did the liver suffer. Is it just a simple fatty liver disease, or is it something more severe? Okay. So if I know the root cause, I would have to know the diagnosis first to know the treatment. Okay. So there you have it. Better go for a consult. Okay.
That's true. Next question from Felisa Fonashare. How about this milk glufarelin? It's advertised that it can cure diabetes. And what vitamins is best for diabetics? Glufarelin.
Glufarelin, to be honest, is the first time that I encountered this milk drink. I'm actually looking at the ingredients about this. It's not FDA approved. Let me take a look at the ingredient. Just looking at it, the ingredients are not that well advertised. On the Yeah, I'm not too sure if this can help. I'm not sure. I'm not sure. I actually don't know. Even the ingredients, this it's not available.
So,
So yeah,
yeah, Doc, I just
the
wanted
answer
to,
is yeah. The answer is I don't know.
yeah. No, I just wanted to bring up the point that you made just now when the viewer asked what's the most advanced treatment of arthritis. I'm looking at the website of glufarelin. So it says there is the world's first high-tech diabetic milk. So that's, I think, the concept that everybody has advanced, right? So you can also see both of us how we are trying to evaluate a new product that comes out. Just because something is new and advanced, it does not necessarily mean that it's the best. All right. For example, how many of you know if you go to the last 10 years, if you go to a health shop, they have all sorts of energy bars. Energy bars are usually when you buy an energy bar, they say it's scientifically formulated to give you energy. But after so many brands, and you will notice also the energy bars that you used to buy 5 years ago is no longer around. So it's always changing. So that's number one. So it's always the most advanced. But actually they don't stay long in the market. Up to today, one of the best foods as an athlete you can take, and you will see this at Wimbledon tennis, right? I'm not so sure now, but definitely sometime earlier. The athletes will be eating a banana. The athletes will be eating a banana instead of an energy bar, unless they are sponsored by the energy bar. So I just want to share with you that we don't really have to go for super high-tech stuff all the time. In fact, when it comes to everybody knows this, right? Would you rather have the high-tech orange juice or basically fresh squeezed orange juice? It's quite clear which one is good. So we're not making any comment about glufarelin, but I just want you to understand why we are trying to understand the mechanism of it and what's the ingredients of it, because we already have one of the best approaches to dealing with diabetes, right? Number one, if you're dealing with diabetes, stop eating fatty foods, okay? No matter how good or how high-tech this milk is, if you keep creating the problem, you're gonna stay diabetic, right? So there you go, the best logic. And the next is that we know how our PPAR mechanism works, and we know it goes after inflammation. It helps you manage your blood cholesterol. We know how it works to bring down your blood sugar by making your cells insulin sensitive again. So all these are proven and effective, and more importantly, proven to be safe. No contraindication with your drugs, right? So you will notice that, for example, for cancer patients, doctors are very worried. Doctors are not worried if you take a multivitamin pill and you're taking chemotherapy, but they're very worried if you're trying a new product that's in the market that someone said can cure cancer, right? Because again, high-tech does not necessarily mean that it's good. Don't forget, every year, the latest high-tech drugs, many high-tech drugs are not passed by FDA because they also have high-tech side effects. Okay, so I think that's why as supplements go, you will notice on our program, Dr. Jansen and I always recommend things that are, for example, it's good to take Malangai capsules. It's good to take curcumin, turmeric. These are not high-tech at all, okay? When you want to take foods for health and long-term, you want the ones that are proven that we've eaten for hundreds of years and no problem and have health benefits. So that's where we go. So with specific to your gluferolin, I think do more research, okay? But I just wanted to share with everyone how we assess foods and supplements for ourselves and for our loved ones. Yeah. I hope that helps. Okay.
Yes, that's true. Okay, next question from Ring Normai. Good evening po. Does drinking powdered collagen milk and collagen tablets will contribute my uric acid result?
Will it affect uric acid? No, it won't. It will not.
Okay, that's short answer. From Manuel Sueñogo, what caused the loss of ligaments on my knees?
Oh,
Depends on what you have.
what are some of the things that will result in a ligament wearing out?
Injuries. The most common one would be injuries. Would there be any condition in your body that will dissolve your ligaments? I don't think there is, aside from trauma, physical trauma.
No, will inflammation sort of no, yeah, you're right. The inflammation doesn't cause the ligament to it's actually a result of your no ligament, and then your bones are rubbing, then you have the inflammation. Doc, as I'm aging, I'm gonna be 50 years old next year. Oh my goodness. I did actually look into collagen, not to look young. I was concerned with collagen for ligament health, right? Because collagen is basically building block, and I think there are type 1, type 2, type 3 collagens. Would that actually help? I mean, my initial, when I was looking at it, I realized, oh, you don't have to take a lot of it, but eating collagen-rich food does help, especially if you move as well, you exercise, causing the body to repair and use the collagen and maintain your ligament.
Yeah, that's true. Actually, for patients who have arthritis, collagen supplements are also recommended, no? Especially by orthos. And it doesn't just help it doesn't just help your joints, because collagen, actually the whole human body is made from collagen. Collagen, actually the whole, if I remember correctly, oh my goodness, my professors are gonna kill me. If I remember correctly, there are 7 or 8 kinds of collagen in the body. Type 1 is bone.
Yes.
The bone is made from collagen. Number 2 is cartilages, so that's for the joints. For your nose, for your ears, anything that is made from cartilage, it also has collagen. Type 3 is membranes. Okay. Number 4, membranes like the blood vessels, and anything that is film-like. Okay, that's number. Yeah, I no that number. Oh my goodness, I am forgetting already. This is basic stuff in med school. But yeah, 3 is reticular substances, usually lymph nodes. Number 4 is the basement membranes. Number 5, I forgot already. But those are the 4 types of collagen. So essentially, every part of our body, every part of the human body is made from collagen. So if you take supplements, collagen supplements, that can, in principle, help your body. The thing is it absorbed? That's the main thing. So I cannot say for specific products because I do not know. I haven't seen any studies for a specific brands. Okay, so that's just me.
Actually, Doc, to go even more specific, when we take these collagen supplements, we are not taking collagen because collagen cannot be absorbed in your stomach like that. It will be broken down into peptides, and then the peptides will be recombined, and new collagen will be created.
That's true. That's true.
Right, but they're basically for everybody's information, they are usually porcine, which is from pork, bovine, and fish collagen. All right, so your sources of collagen powder is usually from one of these three animals. All right, so I do have a friend who actually supplies raw material collagen for use by Japanese and Korean manufacturers. And Doc, I look at his skin. He's older than me, but he has no wrinkles. You know, so yeah, I do think, and I do know that yeah, there are products out there, collagen out there, which are really good. Maybe one day we will do a program. I have no idea how we will assess whether the collagen is absorbed or not. All right, but for everybody's information, yeah, even me, I'm interested in collagen, and I take my friend's collagen, right? So, but I don't sell it. We are friends, so he gives me like from the factory kind of thingy. Yeah, and then it works, and it's good. So it's good that you're asking about collagen for those of us who are aging, and if we keep ourselves active, taking collagen, basically taking peptides will actually help your body build new ligaments, and it also help you build your gums, your skin, everything, right? So it's really important. So yeah, I hope to the person who's hoping that collagen will help his ligaments, it should, right? Maybe you just try the different brands and see which one works, and you can feedback to us on our program. All right, on which collagen works for you.
Because of that, Miss Lainita Sanchez asked, chicken feet are very good source of collagen. Will you advise us if this is really good to eat?
Oh, what did she say?
Chicken feet.
Chicken feet.
Chicken feet. Okay, we talk about lifestyle natural. Yeah, Doc, I don't know about chicken feet, but I do know that the Chinese spend hundreds of dollars on sea cucumber. If you go to a restaurant, it's the same price as bird's nest or what's that called? Shark's fin soup, sea cucumber. So that because that's also very rich in collagen. I think if you wash your chicken feet clean, your Adidas, right? That's what it's called in Philippines because it runs fast. Okay. I guess you have to eat it regularly all the time. I mean, over the years, like without fail, maybe 3-4 times a week, for there to be sufficient collagen to maintain, right? Yeah. If not, that's why we do supplementation. Find a collagen supplement and we eat it every day, right? A small amount. We don't have to eat a huge amount. So yeah, maybe send a picture of your hand. We see how smooth your skin is, so we can know whether Adidas is good for skin. But I do know, because the Chinese also eat chicken's feet. We don't call it chicken's feet because that's terrible. Philippines calls it Adidas. We call it phoenix feet. The foot of the phoenix. All right. Yeah. Okay. Yeah, that was a fun question. I don't think it's bad. Is it bad? Chicken's feet, Doc? Doc Jansen's gonna say anything.
Yeah, okay. For chicken feet, that's an interesting question, no? But yes, chicken feet is actually very rich in collagen. However, I am more concerned of the other effects of the chicken itself because it has fat, of course. Although it's a feet, it still has fat. The skin itself can be fatty, depends also on how you cook it. So it might influence your cholesterol level, your triglyceride levels. So these things will come into play. So I cannot really say that hey, go and eat your chicken feet.
Yeah,
You'll
yeah.
glow.
I done my
Your skin will glow. No, I cannot say that. No, but however, know this. Although yes, it is true that chicken feet is rich in collagen. It can the chicken skin wrapping around the feet is also rich in fat, and it also depends on how you cook it. Okay, so I leave it at that.
Yeah. What an interesting name. In Philippines, that's called Adidas. I always thought
Yeah.
that was very creative.
Okay. That's very fun. We're almost at the end of the webinar. This will be our last question for tonight from Hien Jacinto. Carpal tunnel syndrome and finger trigger, is it considered under arthritis? Is there any remedies for this kind of health conditions? Can PPARs help?
Carpal tunnel syndrome and trigger finger. So first, let's define what these two illnesses are. Carpal tunnel syndrome is when you experience numbness on your thumb, your index finger, your middle finger, and half of your ring finger. Okay? And the numbness is only on the side of the palm and not over here. Okay? So what causes the numbness? There is a nerve called the median nerve that runs underneath your wrist. Okay, that supplies that innervates these four fingers of your hand. Now, on top of that nerve is a ligament. That is what you call as your carpal tunnel ligament. Okay, and that is the more common name of that ligament. Okay, when that ligament thickens, then what happens? The median nerve underneath it will be compressed. Then that will produce the carpal tunnel syndrome that we know of. So, carpal tunnel syndrome is not arthritis. Okay, it is not an inflammation of the joints. Rather, it is an inflammation. It is caused by an inflammation of your ligament or your ligament thickened. Okay, so the solution for this is what? Number one, if the symptoms are not yet severe, then physical therapy is the way to go. Some other medications that reduces numbness and some vitamin D supplements can help. Okay, for mild conditions. If the condition is quite severe already, then surgery is the way to go. Okay, for trigger finger, different. Trigger finger, so for your finger, no, how can we bend our fingers like so, flex our fingers like so? It's because we have a ligament or a tendon that is attached to this part. And for trigger fingers, it's when our finger is maintained on this position. Okay, we cannot stretch it, or if we stretch it, we cannot do it just like this. We have to use the other hand to pull it like so okay, to straighten it. That's trigger finger. So the problem there is a thickened ligament again. So that has to be cut. Okay, that has to be cut to restore the previous function. So trigger finger and carpal tunnel syndromes are not arthritis. It's a problem of ligaments and tendon, no, for that matter. The remedy for this, there's no home remedy for this. Okay, no amount of supplement will help this because the problem is anatomic. So the solution here should also be anatomic. So either physical therapy or surgery. Okay.
Thank you, Doc Jansen. Would you like to add anything, Sir Shan?
No, I'm just looking at a question. There's Miss Josephine Chua who asked,
Okay.
for someone that she's undergoing, or maybe she or someone close to her is undergoing chemotherapy treatment and already finished the 6th treatment. Creatine is 46.8 and SGBT is 89.4. The onco said is because of chemo treatment. Is there a need to worry? What should be done? I think that is one of the side effects of chemotherapy, right, Dr. Jansen? The solution is, there are solutions. You should always protect yourself to against the side effects of chemotherapy. On our program, although many viewers want to ask us about natural treatment of cancer, both me and Dr. Jansen are not against chemotherapy, right? What we tell patients, in fact, if you're stage 4, 3 or 4 patient, chemotherapy is probably very important that you go for it because time is of the essence. Now, what is missing for most people who undergo chemotherapy is that they don't do anything to mitigate or to protect themselves from the side effects of chemotherapy. Now, the common answer for most oncologists is don't take anything while you're undergoing my chemotherapy. The reason why they say that is not because you can't take anything, but because many patients try to take crazy things or things, weird products, and those products might have a contraindication with the chemotherapy drug that they're undergoing. Now, of course, also remember, when you are undergoing chemotherapy, your body is under stress. So taking anything unusual from vitamin C and multivites, the onco will freak out, or not say freak out, he'll be worried, right? Because he is not an expert in supplements, and there are always new supplements being introduced every day, especially targeting cancer patients. So the onco is not wrong, and he is right that he is worried that whatever you're taking, he doesn't know what it is, and it might contraindicate with his chemotherapy. So that is why most oncos will just tell you, don't take anything, just eat food, simple food, right, during your chemotherapy session. Now, the good news is for us, as you can see, Dr. Jansen is so well versed in chemotherapy. He supports cancer patients specifically. That's his emphasis and his area of expertise. So he has very carefully understood how to use supplements that he has totally researched, for example, like our PPARs, to support cancer patients. On top of that, we actually tested our PPAR our PPAR extracts with chemotherapy drugs. So the biggest thing that your onco is afraid of, the contraindication, we actually tested it, right? With cisplatin and oxaliplatin. So these are the two most common chemotherapy drugs used for more than 14 types of cancer. So that's why you can be confident that you won't have a contraindication. And we've actually proven in our research and also from the results of patients that we actually protect you from the side effects of chemotherapy. So for your SGBT levels and your organs, basically it's your kidney, liver, right? That's why the creatine count went up for many possible reasons. But taking our protocols under the care, especially under the care of Dr. Jansen, you're going to be able to have normal levels of these things. Or even if they are slightly elevated, you can be assured you're going to be fine. Because you're also repairing and protecting your body against the side effects of chemotherapy. Doc, you have anything to add? I mean, you have patients that are so weak that cannot continue chemotherapy, and using your lifestyle modification and PPAR protocols, they actually got healthy enough to go back on chemo, right?
Yes, correct. But for this patient, since I would presume that the chemotherapy is already done because 6 cycles already, and we're only worried about the recovery. There are a lot of things that we can do actually to help the body recover. So that one is trying to eat healthier, trying to exercise, and of course taking PPAR protocols. Those 3 can greatly help already. There are also some other modalities like IV vitamin C drip, but the creatinine is elevated, so might not be a good option. Another option would be ozone therapy. Ozone therapy can also stimulate the healing of the body. So those are just some. No. Immune drips can also help. Yeah, basically that's about it. But this is really expected, no? Because once you undergo chemotherapy, especially these 6 cycles, and if the chemotherapy is quite toxic, then these things can happen. However, your body will heal. Okay, rest assured, your body will heal. So it would just be in God's time. okay, this will go back to normal. Okay, because once you're already once you're off chemotherapy, then yeah, your body will begin to heal itself. Okay, it's just that how fast will your body heal? That would be the another question that remains to be answered. Um, so yeah, so basically we just feed your body the right amount of nutrients, the proper environment to hasten recovery. So that's it, no? But so I can help you much better. Please go for a consult, okay? Because with this alone, I will not be able to make the proper recommendations. Okay.
Okay, I'm afraid that's all we've got time for today. Sorry, I can still see a lot of questions coming in, but don't worry, we will answer each of your questions next webinar or via direct message. And to keep yourselves updated with our latest online events and promos, please don't forget to like our Facebook page and subscribe to our YouTube channel to replay and share with your family and friends our very informational weekly webinars and very informational success stories. We have to.
Yeah, sorry, I just wanted to take the opportunity because we have new viewers, and thank you, Miss Josephine Chua, for such kind words, and of course to Lily. I just wanted to say that come October 14, you can catch me and Dr. Jansen and another person, which is our oncological surgeon. So if any of you have surgical questions, right, you can see us live in person at BGC SMX Aura. All right, we will be there for the whole Saturday morning till noon. It will be a event. So who will be there? That we will actually have cancer survivor of a pretty serious metastasized stage 4 complicated breast cancer, metastasized to the brain and bone. Full recovery. She survived. She's going to be there to share. So you'll be able to ask questions like, what did you eat? Did you lose your hair? She went through chemotherapy. Her journey is very interesting because she started totally natural. That means she tried to heal her cancer natural, but in the end, it got serious. She did a mastectomy. So she went for operation, but she still wanted to stay natural. So she didn't go for chemotherapy the first round. Then it seemed like everything was well, but then the cancer came back and it was very aggressive. It went to her brain. And then the second round, she took chemotherapy. Her hair, she shaved her head and everything, hair drop and everything. But she was also on PIVA protocols. And honestly, me and Dr. Jansen were like, okay, this is a very difficult case, but we are so happy. She's totally fine. Because she has 2 lovely kids. So we're very happy. She's going to be there to share. Right, and then we can ask questions. Dr. Jansen will be there live, so will I and Dr. Jimmy. So questions on cancer, questions on surgery, questions on how to be healthy, from metabolic to cancer, whatever it is, we are there to answer. So look forward to seeing everybody 14th of October. And with that, I don't have any last words.
Dr. Johnson, would you like to invite them?
Yeah, if you want to see me in person, ask questions face to face. So this would be like a free consult. Okay. Please feel free to register and feel free to register for our October event. It's going to be at SMX Aura. Okay. So see you guys there. So that's it for me. Okay. So back to you, Jen.
Thank you, Doc. Thank you, Sir Shyan. That's limited slots only, so book your seats now. Scan the QR code to register. And do not miss out on the free giveaways worth 2,000 pesos. Okay, guys, we hope to see you all in our future webinars to come. Same day, same time, every Thursday night at 7:30 p.m. Next week, September 14, we have another detailed patient case presentation about risks and treatments of prostate cancer with stroke. And up next is our quarterly awaited VIP meetup on September 27, Wednesday, online via Zoom, entitled The Edge of Taking Immediate Action, an Effective Formula Through Lifestyle and Diet. And we're all here to invest in our health And Simply Nature Peppers is also good for healthy people like me as prevention, be it from cancer, hypertension, gout, liver, or CKD. If you didn't know, for as low as 650 pesos, you can start your health journey with us via official Shopee or Lazada Mall. So do not wait for the holiday rush to get the best gift of health. Once again, for watching Simply Nature webinar powered by SMG or Simply Healed Medical Group, because your curiosity about your health condition and your victory over cancer and metabolic diseases is what keeps us going. Because here in Simply Nature, we are always with you from start to healing. Thank you, everyone. Good night and God bless you all.